My name is Heather Sudduth, and I am the Stroke Coordinator for Senior River Health System. Welcome to our monthly stroke support group. Each month, we strive to provide a topic that can apply both to the stroke survivor, their family, and their caregivers. Today, I have the opportunity to talk to you today about a subject that's sometimes considered taboo to some people, others just a normal part of everyday life. Today, we're going to talk about sex after stroke. So let's talk about sex. So before we get started, I do want to put out there that this presentation may not be suitable for all ages, may not be appropriate for younger children to watch, so viewer discretion is advised. So how comfortable are you talking about sex? So there may be some reasons that we may not want to discuss sex after stroke. We may not think it's pertinent to the stroke survivor's illness. We may have a lack of knowledge on the subject. We really aren't sure who really should tackle the subject with the stroke survivor. Should it be a member of the treatment team? Should it be a family member? Should it be the partner? Sometimes nobody really knows who's kind of responsible for the subject. Sometimes we place value judgments. It may be that we think that the stroke survivor may be too old to be engaging in sex, so maybe not really sure if we should address that subject. Sometimes we don't want to invade their privacy. They may think that you're perverted, something like that, or we just might be plain chicken. Some of the reasons we should discuss sex is that it is an important part of the stroke survivor's recovery, and we don't want them to rely on myths or misinformation or misconceptions as they try to deal with their sexual concerns. They may feel like they're no longer a sexual being after having a stroke, and they may not think it's fitting for the treatment team to discuss their sexual concerns. But in all reality, who's having sex out there? A lot of times, when we were talking earlier about value judgments and thinking somebody may be too old, actually 76% of people ages 65 to 80 agreed that sex was an important aspect of a romantic relationship at any age. And 2 out of 5 people indicate they were actually sexually active in the study, again, from 65 to 80 years of age. Now, there's 2 studies that I have this data from. One was back in 2007, which is the one that addressed people ages 57 to 64, where it said that 73% of those people were sexually active in that age range. That age range, there's not a lot of research and data out there, so there's not really been any updated data since 2007 on this subject for that age range. But when you get into the 65 to 80, there's been several research studies done. So you can see on this slide that 46% of people age range 65 to 70 were sexually active, 39% of people 71 to 75, and 25% of people 76 to 80. So you can see that as age increases, sexual activity does decrease, but even all the way up to the age of 80, people are still sexually active. So does the stroke survivor want to talk about sex? So there was a study done that revealed that patients not only wish they had received more information when they were in the hospital, but they actually cited as a priority of information they wanted to receive. More than half of stroke survivors, you can see 57% say their sex life has changed since their stroke. So something of note here is even just 10, 15 years ago, stroke really seemed to be more a senior adult type illness, where you're looking again at that 65 to 80-year-old range. But over the last several years, we've been seeing more people in their 30s to 50s having strokes. The numbers have increased with this younger population. So, this topic really spans a wide age group. So that you can see on this, who are people really comfortable talking about this with? Again, there's just it could be taboo, it could just be weirdnesses, that people feel talking about this subject. But we do see that 62% of people feel more comfortable talking with their healthcare provider, then 36% with their spouse or the partner. Then some people, 17%, don't feel comfortable talking to anybody about it. And then you have about 10% that feel comfortable talking to a family member, a friend, or another person. So how do we prepare ourselves to have the talk? So first, we have to recognize our own values and attitudes as a means to move beyond any personal barriers that might get in the way of our discussion with the stroke survivor. And it may be, your partner, or it may be a caregiver having this conversation. And as a healthcare member, we have to look at these same issues. Do not judge what you think, who may be interested in sexual activities based on their age, their gender, their marital status, or their sexual orientation, and even their disability. So sometimes people may think, oh, they have no movement on the whole left side of their body. There's no way they can be interested in sex right now. But that's not true. So you want to talk with the stroke survivor openly with these, because you don't know what their opinion is on it right now. We all need to educate ourselves on stroke and sex after stroke. So there's this model out there called PLICIT. This is a great way to have a conversation about sex after stroke. First, it talks about permission, and then limited information, specific suggestions, and intense therapy. And as you go down you can see the top of the model down, is where you might need more professional intervention. So we can start with the permission, the limited information, and even the suggestions. May not need a trained professional, but as you get into the intensive therapy is where psychiatry will be needed. So we're going to break those down a little bit so that you can kind of understand them a little bit more. So permission allows the stroke survivor to feel new feelings and experiment with new thoughts or ideas regarding sexual function. This is where you allow the stroke survivor to start talking about the topic and engaging in it and feeling comfortable talking about it. Sometimes, you can actually do this in writing. You can actually say, hey, let's talk about this, and write down on a piece of paper what maybe some of your fears and concerns are, different things like that. And that just will start the conversation that may not be as threatening to somebody that may be uncomfortable talking about it. Then you move into the limited information stage, and this is where you explain the effects of the disability and how that may have the impact on sexual functioning. And these explanations don't need a lot of detail. You can just kind of high level how certain medications affect certain things, how the disability may affect different things, and then you get into the specific suggestions where you can give answers or give ideas to help with that specific problem that relates to the stroke. So the next level is really definitely where you have to get into some professional help. And normally, again, a psychiatrist would deal with this, would be intensive therapy. And this is really reserved for the rare stroke survivor who has abnormal coping patterns in dealing with their sexuality, or just really needs a lot of help. And there's nothing wrong with that. Everybody responds differently, and people have different levels of disability. So definitely utilize those resources if needed. So if you're having a conversation as a stroke survivor with your partner, or if you're the partner having a conversation with the stroke survivor, or if you're a caregiver trying to engage your sibling or a parent, or if you're a healthcare provider having a conversation with the stroke survivor, what do you talk about? So the main things to talk about are those factors that affect sexuality. So the big ones are communication, depression, medication, pain, and incontinence. So we're going to hit all 5 of those areas in this presentation. So the first one is communication. So first of all, we have to be able to speak openly about the sexual needs, desires, and concerns. And really one of the biggest things is fear. Stroke survivors and their partners want to know, is it safe? Stroke survivors may not feel if they're attractive anymore. The caregiver, maybe, can I be a caregiver and a lover? So it's kind of like there's a lot of things out there that are issues to talk about with sex after somebody's had a major change in their life, like a stroke. So you can see 32% of people that were studied were actually too scared to have sex. A lot of people have a fear of having another stroke during sex, but just so you know, the chance of that is very low. One of the biggest issues is blood pressure post a stroke. But there's really no difference in having sex and participating in some sort of exercise routine. You're all looking at your blood pressure, and so really it's safe unless you're kind of got a more of a rare case kind of in. So if you're concerned anything about your blood pressure issues and if you're safe to have sex, just talk to your doctor and they'll let you know. But for the most part, the majority of all stroke survivors should be fine with having sex in terms of fear of having another stroke. That, again, is a very low risk of that. One of the bigger things as well, too, is mate rejection. Both the stroke survivor and their partner need time to adjust to the changes that have occurred in their life. A lot of times there's just a lot of anxiety about sex, and what I like to say is, in reading through research is, sex is not a performance. It's not something you have to succeed or achieve a goal in, and it's not going to be perfect every time, with lack of energy, medication issues, some parts, arms or legs being paralyzed or having spasticity. It's going to take some time to figure out what's the best way to engage in these activities for you and your partner. So take the time, explore options, and don't put too much pressure on yourself, because then you have that failure to perform. And again, just take time. Trial and error is kind of the biggest thing. There are medications and treatments too if there's issues. Now, some medications will cause problems that you have to work around, but if there's other issues, there may be medications that can help with that. So the next thing we're going to look at is emotions and mood changes. A stroke can definitely affect how a stroke survivor feels about their sexuality, how they feel about themselves. Definitely can have body image issues and concerns if they're desirable. And then people that have physical disabilities or mobility limitations, this can be even worse for them. They may also think that their partner won't be attracted to them anymore. In addition to questioning their sexuality in terms of how they feel about it, they also may have a range of emotions from anger to irritability, sadness. We see depression a lot of times post-stroke. And definitely these different emotional ranges can impact the interest in sex. So let's talk about depression is very common in stroke survivors, but also keep in mind depression can be a part of a caregiver's or a partner's mental health too post a stroke. So the whole family is affected by a stroke, and stroke is sudden onset. It comes out of the clear blue, so this isn't anything anybody could plan for. So for both the stroke survivor and the partner, depression can cause a decrease in their desire to be intimate. It can feel unattractive, lack of interest in giving or receiving affection. So the good thing is there are medications out there for depression. There's antidepressants, and there's also the ability to talk to counselors and therapists to help you with that. There's some medications, which are going to be the next issue that we're going to look at, that can affect sexual desires or abilities. One of the big ones is antihypertensive. So these are medicines that, kind of keep your blood pressure down. So antihypertensives can cause erectile dysfunction, vaginal dryness, and it can decrease your sexual desire and your sexual excitement. And so with antihypertensives, since they do lower your blood pressure, you definitely want to plan any kind of sexual activity right before you take that pill so that it will decrease the chance of any kind of impotence caused by the medication. And so for males that may be taking any kind of medications for erectile dysfunction, they definitely need to avoid it for the first 3 months post-stroke so that they can make sure that their blood pressure is under control. There's other medications out there besides antidepressants that may decrease sexual abilities, and those include tranquilizers, sleeping pills, antidepressants, alcohol, antihistamines, diuretics, and sedatives. And please remember, don't ever stop taking a medication prior to talking to your physician. So the next topic we're going to talk about is pain. So as you know, pain can contribute to loss of sexual desire, impotence, and the ability to have an orgasm. And to be honest, if somebody's hurting, they probably have a lot of lack of interest too in having sex. So one of the things that can cause pain with a stroke survivor is spasticity. Those muscles are really tight and contracted, and this normally happens a little bit down the road post-stroke. And so if you are on a pain medication for spasticity, plan your time of intimacy when that medication is in full effect, when it's working the best for you. Trial and error, as we talked before, may be necessary for you to find the right position that is the most comfortable, the most pain-free. Some find it better to lay on their side, and then you may also find that using pillows and different kind of things to prop different body parts may be beneficial. Another thing that can cause pain is changes in sensation. Some people get numbness post a stroke, which makes you less sensitive to touch. You might experience painful sensations like pins and needles. So it's always a good thing to have your partner approach you from your non-affected side or your normal side where you have normal sensation. Now, another area could be with females, could be vaginal dryness, so the use of lubricants can also reduce pain and increase your enjoyment. Again, always talk to your doctor if you're having any pain post-stroke, and especially with any of these issues. So the last topic of the 5 of the important factors to discuss is incontinence. And so a lot of stroke survivors have a fear of having an accident during sexual activity. So some tips to help with that is to go to the restroom prior to any sexual activity. Don't drink any liquids prior to. Minimize any positions that can put stress or pressure on your bladder. And then you can always just put towels down or plastic coverings on the bed in case there's an accident or a leak. No big deal. If you have a catheter, you can actually talk to your doctor or nurse, and they can show you how to remove it and then replace it so that you can be free of that during sexual activity. You can also get a valve that allows you to remove a drainage bag during sex. And then if you're a woman and you leave the catheter in, you can always tape it forward to one side using surgical tape, and that'll kind of get it out of the way for you a little bit. And then, again, if you're worried about things, you can always take a shower together. That's another option for people that are concerned. So here's a site or a couple of resources for you. Stroke.org is one of the main sites we use for everything in the stroke program, from information on sex to modifiable risk factors, non-modifiable risk factors. You can brush up on your signs and symptoms of stroke and everything else stroke-related. Great resource. And then patients that have aphasia, which is a difficulty to either understand or express what they hear or what they want to say. This aphasia.org site also has some great information for stroke survivors. So here's my contact information. If you have any questions or concerns, feel free to reach out. And I definitely appreciate everybody taking the time every month to click on our Facebook page to learn more about topics that affect a stroke survivor, their family, and their caregivers.